Okay, thank you. So we have a motion and a second. All those in favor signify by saying aye.
Aye.
Aye. Karen and Jeannie, can you hear us?
Aye. Yep, just came on. Aye.
Okay, good enough. We have a copy of the minutes from the previous meeting of September 9th. Any additions or corrections? Do you have one?
No, I would just ask in the minutes if it could be a little bit more detailed into it, so the discussion is not only our memory, but the viewers out there have an understanding as to what we're talking about. Not verbatim, I'm not saying that, but maybe a little bit. It just seems a little.
Microphone, please. We can't hear you.
All right.
You want to say it again?
Jeannie, what I asked for is, in the minutes, if it seems to me to be a little vague, just to have a little bit more as to what we discussed about it and meeting into it, so not only to refresh our memories, or my memory anyway, but yet to, so the public understands what we talked about a little bit.
So kind of the thrust to the discussion, or what?
Yes.
Okay.
Yes.
Good.
We can definitely do that.
Okay. Okay, any other comments? Okay,
Just a quick one. The minutes are posted, so, well, I'm sorry, yeah, you wanted a little more in-depth to the minutes. I get it. Okay. Never mind.
Okay, yeah, there was a motion, okay, motion, was there a second?
I'll second.
Okay, a second. All those in favor signify by saying aye.
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 Opposed? Okay. Item 5 is restorative justice with Adam.
So I found out from Adam that he's not able to be here tonight. He had something come up, another meeting that he had to attend, so he's not here today.
So I have to reschedule him.
Yes,
Okay.
I've asked if he wants to reschedule.
Okay. Okay, we have all, in your packet, you will have received an aging plan and assurances of compliance. So, Jay, are you leading that discussion?
That would be Melissa leading that discussion.
Well, I would think so.
Okay, as you all know, we did discuss the aging plan at our last meeting, at our September 9th meeting, I believe. And each area and aging agency, must develop an aging plan that guides our community programs and services. Aging plans are 3-year plans that must be approved by the state. An aging plan has several phases, and today I am seeking DHS board approval of the 2025-2027 Trempealeau County Aging Plan. So where have we been with this? So we did have phase 1 earlier this year. This started in the spring. We had community engagement as that phase, and we had more than 135 individuals that participated in interviews and surveys. In phase 2, we analyzed the public feedback and learned about the top issues and needs facing our county's older residents. Through their feedback, we developed our draft goals. So in phase 3 and phase 4, we collected feedback and then revised our plan after meeting with the ADRC Advisory Council, Human Services Board, and again, that happened back in September, and the public. And so today, we're almost at the finish line. We are at phase 5. So what we had mailed you last week was the final plan. That final plan includes those goals that we talked about in depth last month. And it also includes a narrative that the state requires and guides us on, which includes program advancement and the organizational structure of the aging unit. So today, again, what I am looking for is that I'm looking for approval of the plan. And then the next step would be the final step, which I'm required to submit the final plan then along with signatures to the state, that needs to happen in November.
Melissa, what would you say is the biggest change for this 3 years from the previous 3 years?
So the biggest change would be just the entirety of the goals. So the state gives us certain areas which are outlined in the plan, and then based on what the feedback was in the surveys and the interviews, then that's how we shaped those goals. So the goals are entirely different than the last plan. I would say the narrative itself is pretty, there's a lot of similarities as the last plan, because there really haven't been many changes in our organizational structure. And really, the demographics of our county are very much the same. What the plan says is we, remain a very aging population. The numbers of those age 60 and over in our county, the numbers just continue to grow. So there wasn't a lot of changes in the actual narrative itself.
Anyone else have questions?
Are you looking for a motion to approve?
Yeah, I think we are. I guess we sometimes have that before we have discussion, but since
Right,
you asked a question, we're kind of informal here, I think.
yeah, I would move to approve the plan as presented.
And I imagine that was discussed in your other committee too, wasn't it? Yes. Okay. Motion on the floor, is there a second?
I'll second.
I'll second.
Okay. We'll let Jeannie second that one since she's out there and somewhere. Okay, any further discussion? Hearing none, all those in favor of approving the plan as presented signify by saying aye.
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 Opposed? Motion carries.
I will say that I think it's very comprehensive, and there's so much in here. But good work to you and all the committee members that put all of this together. Great job.
Thank you very much.
I agree with that. I read it and looked through it. There's a lot of substance, a lot of stuff, a lot of thought, so good job.
Thank you. Thanks.
And the next item on the agenda is the resolution in support of state mental health funding, or increase in funding, basically.
Yes, yeah, so this is something that the Wisconsin County Human Services Association has put out to all of the members, all of the counties, to advocate for the state to basically fully fund the CSP program and crisis services as well. And so this was a template that was sent out to all member counties. And so what we're looking for is that we're advocating, that the full county board would advocate for, send this to the governor as well as our local legislators to consider fully funding both of these programs. The funding, in some cases, hasn't kept up with, as with many things that are state mandated, hasn't kept up with our rising costs and wages and things like that. So, so we are looking for the state to cover, I believe we call it the non-federal match in there, where the state would pay the portion that we're paying currently for that.
Roughly what percentage is the county paying?
It's like 17 point something, 17.3.
A little over 17%.
And the state is paying anything at all at this point?
Yes.
They are.
Trying to think percentages. I do not know the answer to that off the top of my head. But I can look.
You know, a suggestion, I know sometimes we don't send these to I shouldn't say that. I think oftentimes we don't send these resolutions, once they're approved, onto the Counties Association. And I think it would be a good idea to send it on to the Wisconsin Counties Association. Every year, they will decide what issues, what stand the association will take on various things. And then as they lobby the legislature, they have that information beforehand so that they're prepared to take a stand on various issues that perhaps come before the group.
Yeah, actually, I will say, so the lobbyist who represents the Wisconsin County Human Services Association also works for WCA. And so I think we try, both associations, I think, try to sync up. Obviously, we're one portion of the counties association. You know, there's a lot of other departments and services offered, but we do try and sync up and condense into what would our top priorities be. And so there is some collaboration there, but I think it's a good, point to make sure that the rest of the the rest of the counties association would have this as well, you know, for especially these resolutions coming forward, so.
Yeah, and this template was probably mailed out to all 72 counties.
Correct. Yep.
The regional Mississippi Valley Health and Human Services too has been discussing this as well.
Good.
So,
Yeah.
Is there any other discussion?
Do not have a specific figure for Trempealeau County because they have it lumped together with other counties.
Okay.
Have you heard any more discussion as far as what the state is thinking? Where they would be on it?
I don't know. The WICSA leadership does meet with the secretary, the DHS secretary. And so they take the top I think usually the top 3 to 5 priorities that the association would be looking at. And I think the secretary is obviously favorable, you know, towards this kind of thing. But I don't know. In the governor's office, actually, they did support, I forget what it was last time around, in the last legislative session. I think the governor's office was in support of additional APS funding, but I think there was also mental health funding in there as well. So there's favorable reception to that kind of thing, so.
So I think we need to take they're asking for us to take a stand on this, so the chair would entertain a motion to approve this to be sent to the county board to the county board for further consideration.
I'll make a motion
move to
to
approve.
support the state.
I'll second.
Funding.
We have a motion and second. Any further discussion? Hearing none? All those in favor of this matter being sent to the county board for approval signify by saying aye.
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 Opposed? Carried.
Thank you very much.
Okay, next item is the fact that there's been discussion in regards to merger of the Human Services Department and the Health Department going forward. And Jay's privy to all this, so the two of you are probably privy to what's been talked about and rationale. You're gonna give us that, right?
Sure, yes.
All right, all right.
Well, and just wanted to have a little conversation as well, you know, for folks who might have questions or want to address, concerns or things to think about, I guess, as we move forward with this. So, we were approached by Rebecca Gluen, our county administrator, with the health director leaving to take another position. She thought it was a good point to consider this. Because there are a lot of intersections between the two departments and a lot of places where we work together already and could work together even more and become more coordinated and cohesive as one department. So there are a lot of places, especially the ADRC, our family and children's units, a lot of our preventative services as well fit nicely with a lot of the things that the health department does. And the health department does a lot of things that have nothing to do with the human services, although it's still complementary to, the residents of our county. So, so this was not represented as a cost savings measure. This is more of a more coordinated services so that we can provide better services to our residents. So, so to that end, and then we sat down with the Board of Health last week, and Bridget is the chair of the Board of Health, and we were directed there to continue down this path to the merger of our two departments as well. So, one of the things that's been shared, I think, by the board, but by the Board of Health and also by some other folks, is to make sure that the health department doesn't lose its identity and kind of become an afterthought within the human services department, and that kind of thing. And that's definitely something we want to pay attention to and make sure that doesn't happen as we head down this path. So we're working with our state contacts. Jen Como, before she left, had talked with us about where we were at on a lot of different things. We had an all-staff meeting with the health department this morning, and just to see where all the different programs are at, the contracts, the grants, all those kinds of things. And so I think we have a much better finger on the pulse of well, I shouldn't say much better, but better than we had before, idea of where the department's at. The other piece we've done is we have hired an LTE part-time health department manager who can't serve as the health officer because she's not full-time, but that's Chris Hovell, and years ago, she was the health director here, or the health officer here in Trempealeau County, and I believe she worked for Trempealeau County for 17 years total, and then she went to Jackson County, where she was the health officer for, I believe, 10 years, and then after that, she spent 7 years as the Director of Health and Human Services for Jackson County. So she graciously agreed to come out of retirement after she retired in December to help us with the department. We want to assess the needs, but we do want to get that position posted. It will be a health officer / manager, and that person will supervise those staff there.
That would be eventually a full-time job?
That will be a full-time, yes. Chris is just doing this as an interim, just to help us out, because she's got so many years of experience, and she's great. I worked with her as directors together, and I like her style. I like her approach. I like her style of leadership, and she brings more knowledge from the public health arena than I could ever hope to have. So, yeah. So
If I'm not mistaken, her dad was on the county board at one time, right?
Yeah, yes. Dylan.
Really wonderful man. He was on the Parks Committee with me years ago as a citizen member.
And she's very passionate
And
about public health too, so.
Yep, she's amazing. I got to know her when she would come and get her dad at the meetings and stuff,
Yeah.
and working with Jackson County. So that's really cool that she's helping. I like that.
And what day did she start, or will she
Well,
start?
we intended for her to start this coming Thursday, and then when she found out that we were having a staff meeting this morning, an all-staff meeting, because it had already been scheduled, she said, I'll just come in on Monday. So she came in this morning, filled out her paperwork with HR and everything, and so she attended the all-staff meeting this morning.
And she'll be working, how many days a week then? Do you
She'll be
know?
working part-time, especially initially, it'll be probably 20 to 30 hours a week. And she's obviously got a lot of different things that she had already planned, prior to me contacting her, but, so we've agreed to work around kind of some of the things that she's already got in place. The other piece of this to know is that I've contacted another county, and until we kind of have this agreement, I'd rather not say which one, but, because I don't know if we'll have it with this county or not, but we need somebody who's a full-time health officer in order to approve things as far as the health department goes, and function as our technical or official health officer with the state as well. So basically, this person would be health officer in name and fulfill those essential functions, but then Chris will be doing many of those other tasks, kind of, I call it behind the scenes, but she'll be very much working with the staff there until we've hired our new health officer and manager. So
So
that was
does-
a mouthful, so I just want to make sure everybody.
Does she have specific days she's trying to target as far as work, or
We don't yet,
just,
no.
okay, so that's kind of, can you shoot me an email with her contact and
Oh,
stuff?
sure.
So that I can
Yeah.
introduce myself to her?
Yes, absolutely, I can do that.
Richie? What are some of the benefits of merging and, I mean, why the merge? They've been separated for many, many years. And I know
Right.
Jackson County were separate at one time, but they merged several years
Right.
ago. So
Yeah.
is it a benefit to who? I just,
It's actually a benefit both ways, and there were a lot of things that we talked about in the all-staff meeting today where I could tell the health department staff were kind of excited on some of the connections that will be, I think, strengthened. So there's a natural connection between the WIC program, for example, and our family and children's folks, so, because they might be serving some of the same families.
Okay.
And birth to three.
Preventative services, the birth to three program, that kind of thing. So there's a lot of things that have natural connections and could even be better referrals. Matter of fact, I was talking with somebody the other day within our department, and one of our supervisors, and she said, and she's been here quite a while, and she said, we noticed that there used to be a lot more like referrals between departments, and I think as staff have turned over, it's just, naturally that institutional knowledge goes away and those relationships that people had built. And so she was saying, this is gonna be really good because now we can, as far as referrals go, well, our RIA staff, our economic support folks, a lot of the people served by the health department are also on Medicaid, and so we helped with those applications and things like that too. So, there's a lot, the ADRC works a lot with the health department. And so when there are like intergenerational activities or events that are going on, the health department has been at some of those. And so,
I'm sorry.
that's okay, go ahead, Jeannie.
I was just gonna say, I think it's a great idea because there's so much, instead of working in silos with the health department and then human services in their little silo, bringing both together is a benefit to the people that we serve and to staff. And it just, I worked in a health and human services county and it's so much better for everybody. So, I'm really looking forward to this happening.
And I will say too, because I had the same question you did about like, what are the pros and cons?
Yeah.
And so I reached out to Dave Reinders, who's the director in Buffalo. They have Health and Human Services. I talked with Brandy in Jackson. They have the Health and Human Services. And we talked a little bit with the state contact as well. And what Dave and Brandy both told me was neither one of them has ever worked in any other way where it was separated. So Dave said, so take this with a grain of salt, Jay, but he said, that I see all of the benefits because he'll go out with, or some of his staff will go out with some of the maybe environmental health folks. And if you have a home where it's really in bad condition, and whether it's other factors or whether it's the person needs some kind of maybe services or mental health services, things like that. But when you tag team on those, not that we wouldn't do that anyway, but I think this really facilitates that happening better.
better continuity.
Yeah,
Without a doubt,
exactly.
between both agencies.
Exactly.
Yeah, I can see it as a positive thing myself. The left knows what the right's doing, and
Yeah.
you guys, yeah.
I would
You-
agree.
You got, the whole department, both departments got a better, yeah, I get it.
And I think once we have the those relationships built back up, I think we're gonna see a lot more efficiencies too, because there were I think there's probably some duplication even that can happen. And why not use our resources better,
Yeah.
if that's the
And
case.
just to fill you in a little bit, Richard, and for those that may not know, obviously throughout COVID and after COVID with staff shortages, we didn't even have an RN on staff for a certain amount of time. We're lucky to find one. Still think there's an open position for that, unless it recently was filled. But environmentalists, there's 2 required by the state. We don't have to. We hired somebody, lost somebody, hired somebody else, and they were 2 weeks on the job and left. And so there's been a lot of holes in the health department. Not that there hasn't been in human services and other places, but I think that there was nobody there to kind of pinch hit when someone was gone, or when there was a hole to continue to do at least the office work, things like that. So, and then because of all that, the programs that the health department or other health departments would normally be doing, things like outreach and immunization clinics and things like that, they just weren't happening. They've since slowly started back up, but I also think having it under an umbrella of a director and whatnot to keep those things moving would help the health department. Because it is a very small department, but it needs better direction than what we've had recently.
How many full-time is there over there? Health department.
There's like 8, roughly,
There were
right?
11, but I think that included Jen.
Oh,
and
I'm not
maybe-
including like our WIC nurses, because
Sure.
there's a few positions that
Right.
work remotely
Right.
or in another community and stuff like that, so,
Yeah, it's probably 10 or less.
yeah,
I
10 or
would think.
11.
Yeah,
Now, is that at level 2, health department?
yes.
Is there any thought that the merger would take care of some of the requirements to become a level 3?
No, at least not from what I've read, because that's typically a larger county, and it requires a higher level of education on the part of the health officer. And I think it's usually the larger counties that go to the level 3. But counties typically our size, I think, are more so the level 2. Not that, no, I'm not saying it couldn't happen, but that's the little bit I know right now, that's what I've read.
Well, several years ago, there was some discussion of moving to level 3.
Yeah,
That would have been after this young lady. She had moved over to take that position in Jackson, and after that, there was some discussion of
okay.
trying to meet the requirements to move to level 3. Obviously, we didn't.
Yeah, I do think there are some efficiencies to be had too, like with, whether it's phones or whether it's, walk-ins, or, I mean, and I'm not saying all of these things will be tackled, all at once, but I think these are things we're gonna look at and say, okay, now as one department, what makes sense, and where are we duplicating efforts, and where can we reduce that, and then use that time for other things that maybe aren't getting tackled right now, so. So anyway, and we're trying to, and one of the things that I wanted to make sure that we do as we go down this path is to, especially, I always think of the staff, and so I was thinking, okay, so what kind of anxiety is there, and what kind of, what kinds of concerns are they gonna have? And so we asked them to be, and they were very good this morning about, being very candid about what they're thinking, and what do they think we should pay attention to? That's what I always ask people, as we're heading down that path. What should we pay attention to? So I think they were pretty, candid with us, and so I think, so far, so good. I want to make sure that we're not, that we're paying attention to what they would like us to think about. And especially, there's so many different programs, and so many, and different, everybody had, you could tell, had different passions at the table about what they're really into, and it was a really good conversation, I think. I didn't see that there was, much trepidation at all at the table, so.
How many nurses are working right now, do you know?
Do we have 2 now?
I think we just have one, and she's on leave right now,
So
so.
we
But
have-
don't we have one that
I think there's one
is
that's,
remote?
We do have a contracted nurse.
Yes, a contracted
Yes,
nurse,
and so
yeah.
she's filling in right now.
And it has been very difficult. Part of the difficulty is Trempealeau County's pay for nurses. They can go and work in a lot of different venues and make more money and a fair amount more money. I think that'll be something that the department will have to continue to look into to garner somebody and somebody full-time that's well qualified.
Yeah, and I believe our CSP nurse is at the same grade as well as the public health nurse, so there are challenges across both departments with that, and obviously with social workers as well, but, yeah, so, very valid.
Have you heard of any opposition to the merge at all?
Not yet,
Okay.
not yet, and we've been trying to ask, different people
Yeah.
and everything too, so.
At different counties meetings that I've attended, and I've spoken to some health and human service people, directors, as well as supervisors that may chair some of those committees. And I kind of got a mixed bag, because that was the first question I'd say, oh, you're in this, okay, what do you think? And basically, a lot of departments or counties said that they would like to separate out. But when it got down to the nitty-gritty of asking them why, it was usually personality conflicts, not what was going on. So I kind of just threw those in the trash. But there wasn't really anything else that I heard that was really valid.
The one
So-
thing that I was gonna say too is, I had heard from just recently, and I hadn't had time to contact them yet, but I understand that I think it was Crawford and Dorr made the switch to combine, I believe, within the last few years, and so, I could certainly call them and kind of pick their brains for how to make sure that we're doing it right. So,
Well, I would think that it's going to be necessary to maintain the health committee and the human service committees. Is
I
that fair to say?
I think Rebecca looked into that, and I think it would become one
Well, you
committee.
could combine,
To some extent,
Mm-hmm.
I don't know what that looks like, but it will fall on whatever the requirements are.
yeah, I would think you still have to have a medical director on that committee.
Yeah, definitely we'll have to have, currently Dr. Breidenbach is the medical director. History is typically that she can only meet after 5:30, 6 o'clock. She has certain nights, currently it's like a Monday, second week of the month that she's usually available. So we've got some hiccups we need to work out, and I don't think this is gonna happen in the short-term future. I think we're gonna get all of our ducks in a row and make this transition a smart move, an appropriate move. So I don't see anything changing, would you say, Jay, till like January at least?
I wouldn't think so, but I kind of would leave that up to Rebecca and Susan.
Yeah.
As far as that goes.
Yeah,
I don't know, but yeah, I wouldn't anticipate anything changing quickly.
Yeah, there'll be some
And
fun.
there, and one of,
Go
one
ahead.
of the things that, I'm sorry. We have to remember too, there's some little quirks with the, Human Services is not a committee, it's a board. And there are, we have statutory requirements on how this committee operates. So I think bringing in Chris to help with this transition is great because I don't know if she was in Jackson County or if it's just been historically, Jackson County's been Health and Human Services as long as I can remember, but just figuring out how the committees work together will be, something we have to smooth out. I hope we don't drag our feet on it, and that we get moving quickly. Although January is not too far away, it's already almost November, so.
And you're right, Jeannie, the Human Services and the Health are both boards, and both have statutory requirements of how many, who sits on them, what type of people sit on those committees. So I'm sure we'll be getting, that was one of the questions I had for Rebecca, and she was gonna look into that and get back to me, and I haven't heard.
Yeah, I'm sure it's really easy to, there's a Wisconsin Counties Association subcommittee, which is Human Services. When I served on that, there were, Health and Human Services representatives as well as county. I mean, I think it's easy to find out how those committees join together, so I'm not worried about that.
Yep, and
Because I
I,
think the benefits way
Yeah.
outweigh any negative that could eventually come up.
The
And
only,
staff,
the
and
only,
staff that I talked with, they're really positive about it, so.
the only thing I also asked Rebecca about was, as far as meetings go, you have, 50% of supervisors and staff and whatnot, and 50% of your, we don't typically get a lot of people that visit, but you have your community members on the board as well, and so there's all these different avenues of life, and it's hard to find a definite time to meet. And then the other thing is, when you've got a human services meeting that's running 2.5 and sometimes 3 hours, how do you fit in the health part? And those are the little things where they're both just as important. So it's gonna be difficult to create agendas that still stay within a time frame and yet pack a lot of material in a short amount of time.
I'll be honest, that's one of the things I asked Dave in Buffalo about, and he said, yeah, you have to be efficient, and you have to, theirs is structured a little bit differently, because well, it's kind of an old adage, I guess, in the human services world, and probably the health department too, when you've seen one county, you've seen one county, because everybody's different,
Well,
so.
and the Board of Health does a lot of, very similar to what Human Services does, where we get a spotlight on a program at various meetings. And it's not that you can't have those, because I think those are really valuable, but they run just as long on the Board of Health as they do here in Human Services. So how do you take that 45-minute conversation and compile it into 15 minutes or less? It's tough to do.
Well, and I think we can do that, and I don't want to, just worrying about the structure of our committee meeting seems something that we can figure out.
Yes.
What I'm more concerned about is just how positive this is for the agency, and we won't be operating in silos. It'll be one unit, working together, and, we won't have a half hour for health and a half hour for human services. It will be one unit. So that's all I have to say. I just don't want us to get all wound up on the minutia of how we're gonna run a meeting. That can certainly be figured out.
Well, I think in response to the length of the meeting, this would be the same case if it were another committee. If it becomes necessary to have 2 meetings in some months, it becomes necessary. So I guess I would agree with Jeannie that this would be taken care of. Obviously, if you have a lot of business that has to transpire, you just work it in like I say, 2 meetings maybe, it just, if it becomes necessary, so. But,
Well, yeah, and this is our job, this is where all the meat and the potatoes happens at a committee meeting, and that's what we're here to do. I mean, I've sat in on ELU meetings that can go 4 or 5 hours. Maybe not so much now, but I have in the past been involved in those meetings that go a half a day. So, I mean, that's why we're here. That's what we're here for. Not to just rush in and rush out, to get things done, so that we don't spend 25 hours at a county board meeting. All of this work has been done at the committee level, and then we bring our recommendations to the county board.
I take it there's been no study done to look into the merging?
Not to my knowledge.
Oh, I think there's been a lot of history looking at merging the two in the past, because more and more counties have gone to Health and Human Services.
I'm just wondering if this county has looked into it, Jeannie. I understand the pros. I'm just wondering if there's any cons to it, or,
And that's what I was trying to dig into too, when I was asking folks about it, and I really didn't get any, other than not having it shuffled to the background, you know what I mean, or losing the health department's identity and losing focus on unnecessary programs and
have
things
you
like that.
talked to the director that's going out in the health department?
Yeah, Jen Como, her last day was the 4th, I wanna say, and
Did
we
she
had
share her
meetings with.
feeling?
Yeah, well, yeah, we got updates from her and everything like that too, and that was her cautionary note. It was, I don't wanna see, this portion of services relegated to the back, to the back seat again. Anyway, I'm, you know what I'm saying?
Yeah.
Not that they're shuffled to the back, and
You
so-
know, Rich, I think this particular health department, has had a lot of issues over the years, turnover probably being the biggest issue. And there are areas that it could become much more engaged in the future. So I think this is an opportunity for the powers to be to help them maybe become more involved with the community health than they have been over the years. I think there's some real avenues that could open up here. Not that there might, you're still going to have issues, I'm sure. Things aren't going to always go well. But I just, for the sake of discussion, several years ago, it actually did merge.
Oh,
Everybody looks and say, did it really? Yes, it did merge. It was merged prior to an election of board members. And after that election, the board, there were many new board members that basically had the majority, and you remember that time, and they reversed the decision that was passed earlier. So it isn't that it hasn't been thought about over the years.
can you relate as to why they changed it after it went through? Do you remember, or don't you want to go there? You don't have to.
I'm not sure I want to necessarily go there. There were a lot of reasons, and some were political, via the board itself. But at that time, that was after Chris had left, and she had gone to that county to serve as health director in Jackson County. And how long had she been, was she director here? She was director, I think, when I came on the board.
Yeah, maybe, I don't recall.
Yeah, yeah,
Exactly what the timing was.
yeah.
I do think, I'm glad to hear that you had a staff meeting already with the health department staff. I think they're really going to like falling under that umbrella and having the support, because the feedback you get from the human services staff is very positive about where they're sitting under their umbrella. And that's definitely something that the staff in the health department don't currently have. And I think you probably gathered that from your meeting, even though there was a little anxiety about what could
Sure.
happen,
Sure.
but
Just, I guess this is, of course, I think is sort of in support of this concept. But in Blair at the senior meals, as you probably know, there's a group of student nurses that come in on a regular basis and provide a health clinic for people who, you have to make appointments because they fill up. And that's something that, I don't know whether our health department would ever do that at any of the senior meals, but I think that it's been found to be extremely beneficial and well received. Like I say, you have to make an appointment or you don't get in.
And that's Bridges Health, right? That's
Pardon?
that's Bridges Health through the Winona State
Yes,
students. Yeah.
yes.
Yep.
But
Yeah.
I think with the health department working in conjunction with the various sections within the department, you know, it opens up the opportunities maybe.
Yeah, we did talk quite a bit about some of those places where we intersect and
Yeah.
how we can kind of leverage each other, you know, to,
Yeah.
and again, not duplicate, but only enhance, you know, what we've got, so. Yeah,
I just did a little quick count, and out of 72 counties, and I don't know how accurate there's 34 counties that are health and human services.
So
And really some tiny counties too, like Adams County, I mean, Ashland County. So it's a trend. A lot more than when I started as a social worker.
Any other questions or discussion? Okay, Jay, your turn for the director's report.
all right. Let's see here. So there hasn't been much change in vacancies. Currently, we still have the youth diversion caseworker open. We have the part-time dementia care specialist position. I believe that's posted now, if I'm not mistaken.
Is that open yet or closed?
It's open.
That's
It's
still open?
Yes, it's posted as far as recruitment goes, though. So,
Now,
And-
what preparation must they have to qualify? Is it the same as any, a social worker or a caseworker?
no, not necessarily. I don't recall the specific qualifications off the top of my head. We had to rework the description a little bit because now it's part-time. But we've had some very qualified applicants who I think they were looking as perhaps a supplement to, you know, what they were currently doing, or, you know, we thought, boy, wouldn't this be a great retirement gig for somebody, you know, who's passionate about that, about supporting, you know, folks with dementia too. So I could bring that back next time though and just talk a little bit more about the qualifications that we're
that's
looking for. Yeah. And then we currently have 2 open positions in our child welfare unit. I think we've had those, you know, for a period of time, and we continue to post those, and they're posted until filled at this point, so. Oh, right, and we do have one other, of course, in Kelly's unit, so she's like, we have a fiscal position too. So, yes, we have that opening because Ashley went to dispatch, so we have her.
What position is it?
It's a fiscal associate.
Oh, fiscal.
Works primarily, I would say, probably with accounts payable and things like that, so, yeah.
Okay.
So, and then, let's see, one of the things that we are doing currently to try and save money for next year's budget is we weren't planning to move the ADRC across the road again to become part of the family again, until next year, once the renovations were done. However, we talked with Melissa Youngbauer and Laura from the ADRC, and they said, you know, if we could find some space, you know, temporary space, that we could move them over here and save between rent and utilities almost $30,000 for next year. And so we decided to do that, to help the budget, you know, situation out for next year. And so we have some temporary shifting where our child welfare unit has moved into the old sheriff's department offices, and the ADRC staff have moved into their offices because that's the closest part of our department to the front door or to the front entrance. So it's a temporary thing. Once the ADRC space the new ADRC space has been renovated, then our staff will move over there. Our child welfare staff will come back to their former offices after there's been a refresh, you know, paint and carpeting and that kind of thing as well, because it desperately needs it. But then the other piece of this is that the veterans folks, so Joe and Wade, will be housed within the ADRC space as well, because we thought that really fit well together. And then they'll also be able to access then, we'll have a front desk person as well, and so we can support them when they're out and about all the time, which they are quite a bit. And then they'll have a little storage space in there as well. But that seemed to make, when we were talking about it with Melissa, with Joe, and with Jeremy and Tim, it seemed to make a lot of sense, both philosophically and then space-wise, to have them housed with the other ADRC staff as well. So it seemed to make a lot of sense. So anyway, so we made a lot of temporary moves, and the staff have been so good about it, and just very team players, and so that's, so we can save hopefully $30,000 for the 2025 budget.
So that'll be done before the end of the year then?
We've already started moving folks over to our child welfare folks over to the sheriff's department, the old sheriff's department offices. And I think probably the ADRC staff are gonna start moving over. I don't know if it's this week or next week. I don't remember if you know.
I think Melissa said they were cleaning today.
Okay, oh, right, they're cleaning up the offices, right, before we move over, so. So it'll be nice to be, I was thinking of it when the space was renovated, but, and when I was in other positions, not at the county, I remembered when the ADRC was over across the street here, and so it'll be nice to have the gang back together again. And it's just more, again, as we talked about with the health department, it's more cohesive, it's more, you can poke your head around the corner and talk to somebody as opposed to trying to track them down, coming across the street. And plus then our county residents, they go one place. It's, all of our services are over here. Instead of, it's felt a little disconnected, so. So we thought it was a win-win-win, and everybody was on board, and so we pulled the trigger, and we're moving forward with that, so.
Just
They'll enjoy those
historically,
luxurious
supportively, in the 17 years I was here, we moved 4 times in the unified board, so I lived through it.
Yep.
It was fine.
Yep.
They'll do great.
Yeah, and we're trying to provide all the support the staff need, and on the days that they're moving, I'm putting my jeans on and helping them too, so.
Okay. I was just commenting about all those luxurious offices over in their sheriff's department. They'll enjoy those.
There's a
Boy, they're
lot of
rich.
space over there, I'll tell you what.
Yeah.
That's very
Yeah,
true, that's very true, yes.
Well, you never complained about that, did you?
Hey, I wasn't ever complaining.
You had to have a periscope in your office maybe, yeah? Okay, any other discussion?
Just 2 more
Jim?
things. One thing is strategic plan work continues with our supervisors and our lead staff. Just not a full-blown strategic plan, but as I had talked about before, just strategic questions that are going to solidify and stabilize the department in a lot of different ways. And we'll bring those to you once we've kind of worked through the last pieces of that. But it's important work in order to create a good environment for our staff to stay here too, so. So we'll bring more information on that. I don't know if it'll be next time or maybe the time after that, just to kind of wrap it up and kind of show you where we've taken things. The very last thing is, our next meeting for this board falls on Veterans Day, so I didn't know and I didn't even think about that until Friday or today or whatever, but, so wondering what you'd like to do about that, whether,
Let's see, that is what, November what,
11th.
11th?
And that is a holiday for the county.
It's a holiday for you guys, so please don't come in and work that day to come to a meeting.
You're way too protective, Jeannie. Wednesdays work the best for most everyone? I'm not Wednesdays, Mondays?
Depends on the Monday.
Yeah.
Yeah, so
Let's see, the first, when do you think you'll be doing the moving?
Well, we're, as far as the ADRC folks,
People moving, yeah.
yeah, by the end of October, I think, is when we're looking now. We kind of moved we had paced it out a little bit, and people have been moving a lot more quickly than we thought they would, so,
Yeah.
because they were motivated, so I don't think it would be an issue. I mean, whenever you wanted to, if you wanted to reschedule it for either the first or the third Monday.
Yeah. What do you folks think? First or the third Monday?
The first Monday we can't because that's Board of Health, and when we tried to do that before, they ran together. So,
That's
What day is county board?
it's gonna end
The
up on the
18th, county
18th.
board is the 18th.
What about the
That's
Tuesday, the
third- that's-
12th?
Yeah.
County board isn't the 18th, it's the 12th, it's during the day.
Oh, that's right.
Oh, because it's November, that's
Yeah,
right.
it's November, yeah. Well,
We
the
could do
18th,
the 18th?
the 18th would be open here probably then.
We could do that.
I have a 5 o'clock meeting on the third Monday of every month, Town of Lincoln Sanitary District.
Okay. What time do you guys
I'd
meet?
prefer it not to be on the 18th, because then, unless this meeting goes till 7.
What other options are available for people?
Does,
Why, the 4th, why didn't the 4th work?
because we have Board of Health that evening,
At what time?
6 o'clock. But the last time we did that, we ran in and there was a delay in the 6 o'clock meeting, and our medical director did not take very kindly to that.
What about the
Oh,
25th?
God. Well,
So,
we don't usually go till 6, or lately I haven't,
Yeah,
have we?
no, we're usually out of here by about 5:30, so that would be the 4th. Were there conflicts for the 4th?
Not for me.
Jay, what do you think?
I think that would be fine. So are you saying 4 o'clock on the 4th, or did you want to?
Same time, 4 o'clock.
Okay.
And we'll just make sure we're done before 6. Nobody can talk more.
actually, Board of Health is now at 5:30.
Well, we can be done by 5:30, unless you have some things come up that you don't
No,
anticipate.
we can be efficient.
Yeah.
And Adam's very efficient when he talks about CJCC, so.
Okay. Is that agreeable then?
November 4th?
The 4th then?
Oh, is it the 4th or the 4th Monday? I'm sorry.
The 4th, November 4th.
On the 4th. I was looking at the 4th Monday.
4th at 4.
Yep, I can do that.
Everybody else is good?
Okey-doke.
Okay.
Yep.
Sounds good.
Hey, I just have a quick question. Is the meeting at 6 o'clock is in person, right? It's not Zoom?
It's in person,
Dick?
in person.
Okay, all right.
That's an issue.
I'll have time to put gas in my car. That's why I had to Zoom. I got in my car and realized I had no gas, so.
Consider it a county
Is-
board meeting?
Isn't there a Zoom link for you on the computer, Jeannie?
Oh, yeah, there is, but the problem I had is I got in my car at 25 to 4 to come to Whitehall, and I realized when we came home from the Packer game last night, I didn't want to stop for gas, so I barely have enough gas to get to Strum. So, if I had gone to get gas before this meeting, I would have been late.
Do that. Get it before.
So
the
now I
meeting.
have a lot of time to go to Strum and get gas and get to Whitehall.
You gotta drain your lawnmower's motor. Okay,
Okay, see you all in a little while.
okay. That's it then.
That's it.
Okay,
Hi, Jay.
Bye, Jeannie.
anybody have
And I
any?
can't see who's sitting next to you. Oh, Kelly. Is that Kelly?
Yes.
Oh, okay.
She said we could
Hi, Kelly.
do 5:30 if nobody.
Okay,
So,
I
we
think
get a
if we
chance to
have
speak.
nothing
gonna
else, we
happen.
stand adjourned until the 4th.
But I'm gonna end it.
Thank
And
you.
now we have to continue.